This afternoon, we have an alert for you from health officials. Many of them say sugar and its harmful effects on our health should be spelled out for you by putting a warning label on food that contains high amounts of sugar. It would be the same way there's a warning on cigarette packages now. So joining me live is registered dietitian Dr. Tegan Mansouri. Thank you so much for taking the time to talk to us today. There's a growing call for warning labels on food to let people know what the sugar content is. So how would this work?
Thank you so much for having me today. So the call for more labeling around sugar is there are a couple parts to this type of policy. It would be one, to label foods that are high in sugar to give people a heads up when so that they know how much sugar they're consuming in a product. And then there are other policies that are implementing tax for high sugar foods, sugar sweetened beverages, things like that. So all together, making an effort to make people more aware of sugar.
Some people are saying that sugar is the new tobacco. Do you agree with that?
So I don't quite agree with that claim. So sugar, our bodies know how to convert sugar to energy, which we need for basic physiologic function. So comparing it or putting it in the same category as a carcinogen doesn't really make sense. There's not evidence to support a claim like that, and it's really misleading.
How soon do you think these labels could show up on the food that we eat?
That's a great question. So I believe New York City is piloting a program currently, and it could take, the time that could actually show up throughout the state and more of the country. It could be months to years. It may never happen. There's still some controversy over it, which is good to raise some concern and question about whether this will be an effective intervention.
And it's good people are having this conversation, but do you think it'll make a difference? If the labels are on things, do you think people will pay attention, or are they just going to eat what they want to eat?
Yeah, that's a really good question. The policy assumes that more knowledge will automatically transfer to behavior change. And, in some, we saw with Al Roker that didn't exactly transfer to a behavior change for him. But also we saw in studies that examined the consumer behavior in response to making calories available on fast food menus, there was only a small reduction in overall calories purchased in response to that policy and making more calories available on the menu. So it doesn't always transfer to change in behavior.
And since we don't have the labels right now that they're talking about, what can people do now if they want to kind of pay more attention to the amount of sugar they're eating?
So my recommendation, for one, is to recognize that it's more important to consider the source, not just the overall intake of sugar. So there's sugar in all sorts of products. We obviously get it from candy, sugar sweetened beverages like soda, cookies, cakes, which we know are good to have for special occasions and not all day, every day. But then where I'm concerned is that there's some fear around consuming sugar in nutritious foods like yogurt, bread, other like granola, cereals, foods like that provide us with a lot of important nutrients. So my guidance is don't worry so much about those foods that we're getting important nutrients from. And it's good to recognize that it's important to have a balanced diet, not just a diet filled with candy and soda all day. So instead of worrying too much about reducing sugar from all sources or reducing to a really low amount, focus more on having a balanced diet, eating more fruits and vegetables and whole grains.
Variety is a good thing. Thank you so much. That was registered dietitian Dr. Tegan Mansouri. We appreciate your time this afternoon.
Thank you so much.